all the attendees of the House of Delegates, the officers of Michigan State Medical Society, board members, the amazing staff, and everybody else present. I have had an amazing year as president of this great organization. And I got lucky because my number was 160, that is 160th president of the society. So, in terms of everything, there were a few things which I had not recognized. And one of them was how fast things move in the House or the Senate, in the legislature locally. Even though I have been to the legislature multiple times over a period of years, it has been quite an experience in terms of how we get to do the work we do for the state physicians. I would like to summarize my whole experience starting from May 25 to now in terms of some bullet points. A full speech will be provided for people to look at if they are interested in the handbook. My bullet points included strengthening the physician-led care. I led statewide opposition to the House Bill 4399, emphasizing patient safety and necessity of physician-led team-based care. There were multiple meetings that had happened to get a sense of how physicians feel, whether they're in the hospital or hospital employed, or whether they're out in private practice. And the unified notion was in talking to nurse practitioners and all the other physician extenders in those practices, they all told me one simple thing that they are physician extenders would like to be supervised by a physician and not the other way around. But there were a lot of test people who came and testified that it is very hard to get physician supervision organized. So we need to do this to get to a point where independent practice is far better. Second thing I was interested in, and this is on my own, I did a lot of work in terms of driving Medicaid reform. I met legislators, I met the Speaker, Matt Hall, multiple times in asking, begging to actually try and preserve as much Medicaid budget as we can because there was a big cutback on the federal budget bill. We got to some point, and I would say, in terms of the legislature, both House and Senate were able to preserve significant amount of budgetary issues for the state of Michigan. And I also attended the bill signings on the Medicaid with Governor Whitmer, where all major uh, stakeholders of the legislature were present. I have met multiple legislators across the political spectrum during this period of time, and I was surprised at how many times you can actually look up online and see who has a meeting or a fundraiser or something locally in Lansing that I can attend. I have been to a lot of them, which gave me access to a lot of legislators so that we can plug our message on every bill that we are supporting or not. The next thing I really enjoyed doing was mentoring the future physician leaders. I have spoken to almost every school except Western, and I have not formally spoken at the Wayne State Medical School. But I have met student leaders from both the institutions in different venues and have actually interacted with them big time on the medical student section meeting of MSMS, which I thought went very well. I gave them ideas, demystifying the scare or fear about the legislative process, and also encouraged them to have early engagement in policy because they are the ones who are going to decide where Michigan moves from now on. I had several conversations in the community with legislators and local community members about the ACA subsidies and what lapse would mean to a lot of Michigan patients. And I was surprised that about 3 to 4% of my community got their insurances through ACA, and they were wondering whether they would be able to continue it without the sub- subsidies being there. The way I looked at it, the whole thing would probably not come or bite this year, but definitely by 2027, we should have a clear cut idea of how much the subsidies helped or didn't. That will be evident in the number of people who are insured and who are not. I was involved through the board in modernizing the MSMS governance, which I think is going the right way. I agree and totally, or most of the time, agree very clearly with the task force that has made the recommendations. And I also would like to recognize Dr. George for his tireless action as well as involvement in the running of MSMS on a daily basis. We couldn't have come this far without Dr. George because the issues that we were having were hurting the institution big time. But I see hope, and I hope clearly that if you look at the states that have done the same things or similar things, they have come out ahead. So I'm hoping that this will be something that will keep the society going for the next 50 years or even the next 160 years. It would be not easy to not mention a couple of other things. One of them was I did go to the state of the state this year and I had the opportunity to meet multitude of people because I went very early. I met family members of legislators. I met the mother of Dr. Long John, had a great conversation with her because he was very busy. But I did bend the ears of people of either side and had a very significant conversation, I think, with uh, Mr. Vanderwall as well as Mr. Hurtle. Kevin Hurtle chairs the Health Policy Committee of the Senate, and I did speak at a meeting as a panelist with him, and I did spend a lot of time trying to show him things that my society would vouch for. In summary, I would say that my presidency was defined by advocacy and unity. From scope of practice to Medicaid reform, from bipartisan outreach to student mentorship, my presidency focused on elevating physician leadership. I have been encouraging all young physicians who are currently involved to tell them that in spite of certain setbacks, what is in their mind setbacks, they are not actually big deals, and everything can be ironed out if you have conversations with your colleagues so that we can have a unified front in presenting ourselves, whether it is in front of the legislature or otherwise. The membership issues will continue to remain. I'm totally aware of that. And even when my presidency ends, I will continue to work, hopefully, with reorganization of the society to try and see if we can get more and more employed physicians be part of this group, which I think is a doable action, and I won't step back as a past president, but be involved in the whole process. I would like to thank not only Dr. George, but the whole team of MSMS, which includes everybody like Rebecca and McLaughlin and everybody else. I don't want to name everybody in that case. I might miss somebody and upset somebody, but I do think our staff is amazing. And even though my days are numbered, I would like to welcome Dr. Phil Weiss, who will be the next president, and hopefully we will be able to take our society forward and try and justify our mission. Thank you.